Yeah, you can see the slide. Yeah, as I've said that, we proceed with the cause of OFD 211, which is, wait a bit, yeah, we are going, sorry, how did they do? What did I do? I'm sorry. Yeah, here I am. Let me mute the video. Yeah, I just want to mute the video and share, continue sharing it. Yeah, I'm sorry for this. Yeah, I just want to mute the video. Yeah, okay, can you hear me?
Yes, madam.
Okay, thank you. I've said that because it's OFD 211, which is nutrition through life cycle. Yeah, and today we'll proceed with the discussion of the knowledge area 3 of the course, which is on nutrition during lactation. Yeah, nutrition during lactation. Okay, let's see nutrient requirements during lactation. Before going to that, why do nutrients requirements for the breastfeeding mother tend to increase during lactation? Why do nutrients requirements for the breastfeeding mother tend to increase during lactation? Can you tell me the reason why? Why do nutrient requirements of breastfeeding mother increase during lactation? Why is it so? Any volunteer? Why is it so? Any volunteer, please? Hello, anyone, you're welcome.
Can I try, madam?
Yeah, you're welcome.
Yeah, I think it's increased due to the process of preparing the mother to generate or to formulate a milk for a baby.
To do what? Can you repeat?
I said due to the preparation of preparing milk for a kid or a baby that is a new baby.
Yeah, because during lactation is during breastfeeding period. Yeah, thank you very much. Yeah. So normally nutrient requirements, they tend to increase during breastfeeding or during lactation than during pregnancy, because the mother must meet her own demand of the nutrients and continuously supply nutrients and energy for the breast milk production. Yeah, so if you get a question like this, ask why do nutrients requirement for the breastfeeding mother tend to increase during lactation? You need to explain a little bit in a broader sense. You just not only mention one sentence and you say this is all. This is one question which might have 25 marks. So why do this means explanation? So you can find just a question, ask why like this, and you think you can answer by using just 2 lines. No. That will not be possible, and you'll not be able to get 25 marks. So when you get a question like this, why do nutrients requirements for the breastfeeding mother tend to increase during lactation? You need to ask her, you need to answer at one point after another, one point after another. For example, the first point will be for production of the breast milk. And you explain this point, production of the breast milk. You say, yeah, the nutrients requirement for breastfeeding mother during lactation need to be increased because there is need of extra nutrients, of energy, proteins, vitamins, minerals for the daily milk production. Yeah. You start with the first point. Another point you're going to say about there is a continuous nutrient loss through breast milk. Yeah, there is a continuous nutrient loss through breast milk. Yeah. So it's not as that the nutrients are lost as such, but nutrients are lost while using in breast milk production. So you say there is a continuous nutrient loss through breast milk. So mother's body does not store any more nutrients. They are used for milk production. So all the stores of these nutrients in mother's body are depleted, are used for the milk production. So there is the continuous nutrient loss through milk production. That's another point. Another point, you can say there is high energy demand. Yeah, there is high energy demand. Yeah, milk synthesis requires significant energy. So lactating mother needs additional calories to support milk production while also maintaining her own body functions and health. That is the third point. The fourth point, you can say there is increased protein needs. There is increase. That means the need of protein tend to increase. Breast milk is rich in protein needed for the infant growth and development. To maintain adequate milk production content, the mother's protein requirement tend to increase during lactation. Another point, you can say there is a greater micronutrients demand. That's mainly vitamins and minerals. So these are needed or transferred from mother to infant through breast milk. So for good milk quality and maternal nutrition status. Yeah, another point is that infant's sole source of nutrition is breast milk through exclusive breastfeeding. So nutrients requirements increase more during lactation than during pregnancy because it needs to have all those nutrients needed by the infant in the right proportion, because it's infant's sole source of nutrition, that's breast milk. So those are the points how you can explain or how you can ask a question such as why do nutrients requirement for the breastfeeding mother tend to increase during lactation. So this is one example of the question which you might get during examination, and you really need to know how to answer them. So why do nutrients? This is explanation question which need more than 3 points, with explaining those points in order to get 25 marks. So it's not something very simple. So that's one example. Okay, let's go to discussion. I just want to pinpoint this. Nutrition requirement during lactation. Yeah, we know this lactation period. Lactation means breastfeeding period. Lactation is the same as breastfeeding period. So lactation is nutritionally demanding, especially for the woman who nurses infant exclusively. That means only breast milk for the first 6 months. Like in pregnancy, adequate nutrition of the mother during lactation is of vital importance, since during the first few months of life, the infant derives all the nutrition from mother's milk. No other sources of nutrients. A well-nourished mother, on average, can secrete about 850 ml of milk per day. Whereas, if that mother is severely malnourished, the amount will go down to 400 ml per day. However, the quality of the breast milk does not suffer as much with the reduced nutrition. Even if the diet is not able to meet her own nutrition needs, the mother draws all her body reserves to meet the need of the lactation at the cost of her own health. That's why quality of breast milk does not differ much from a healthy breastfeeding mother or malnourished, but moderate malnourished. Dietary deficiency of water-soluble vitamins might lead to lower levels of these vitamins in breast milk. We know water-soluble vitamins are easily lost. So in water, so they can easily be lost. But the protein, calcium, and carbohydrate content is not altered, even if the mother is malnourished. So the breast milk can have a deficiency in water-soluble vitamins, but not in protein, calcium, or carbohydrates. Nutritional needs are increased during lactation for sufficient breast milk production, providing adequate nutrients to the infant and meet the mother's daily needs. Now let's look at the nutrient requirement during lactation or during breastfeeding. Let's start with the lactating mother needs an additional energy, an additional calories of about 550 kilocalories per day during the first 6 months. So this is added from the normal amount of energy which is required by the normal mother who is not breastfeeding in the first 6 months. As the lactating mother continues to lactate beyond 6 months, although the milk output is reduced, that's here additional kilocalories now will reduce to 400 kilocalories per day, needed for period from 6 to 12 months. Protein. Lactating mother also needs extra amount of protein, so additional protein required is about 16.8 grams per day for period from 0 to 6 months and 12 grams per day from 6 to 12 months. So in the beginning, we need the addition of more amount of protein, because when the baby is small, you need a lot of growth and development. So protein needed, much more protein is needed comparing to when the baby reaches 6 to 12 months. So the growth also development starts to decrease. So that's why the amount of protein needed is reduced. Adequate amount of good quality protein can be obtained, of course, from animal sources, as we know, milk, cheese, cat, chicken, eggs, cereals, pulse, combination nuts. Also should be traditionally included in the diet for the proper milk production. So should ensure that mother gets good quality protein. If protein and energy are lacking in the diet, there will be the reduction in milk quality. So here we talk about quantity rather about quality. The quality is not much affected, but the quantity normally is affected when there is deficiency of certain amount of nutrients. So the quality similarly remains the same, but the quantity is what is altered due to the deficiency of certain types of nutrients. Carbohydrates also is needed during lactating, and the recommended dietary allowance of carbohydrates needed is 210 grams per day. This amount is enough to provide adequate calories, to provide adequate volume of milk to maintain energy level during lactation. This may need some adjustment depending on the activity which this lactating mother is doing. Because if he's doing heavily duty or heavily activity, will need more calories from carbohydrates apart from 210 grams. So depending much from the activity the mother is doing, lactating mother or breast mother is doing during breastfeeding, of course. Okay, lipids. Lipids also are needed by breastfeeding mother. The amount and type of fat in breast milk directly reflect the maternal diet. So this is one of the nutrients which is highly affect the amount of it in breast milk. The amount and type of fat in breast milk directly reflects the maternal diet. So if the diet, the breastfeeding diet is deficient in fat, it will automatically be reflected. Breast milk which has been produced. The fore milk, which is regarded as the first milk, is lower in fat, and later it's called hind milk. This amount of fat tends to increase. So fore milk or hind milk normally is known as colostrum milk, and colostrum is high in carbohydrates, high in protein, high in antibodies, and low in fat. As human newborns may find it very difficult to digest fat. That's why it's low in fat. Newborns have very small digestive system, and they are not well developed to be able to digest highly fat foods. And colostrum deliver its nutrients in a very concentrated, low volume form of fat. So it's easily and well digested. The first stage of milk that develops during pregnancy, is called colostrum, which is thick yellow in color. And this colostrum lasts for the few days after the baby is born. So this is very important to make sure the infant gets this colostrum in the early days. So immediately after the baby is born, need to be initiated breastfeeding. The total amount of fat required in the diet of lactating mother to maintain milk production differ from one to another depending type of physical activity and overall nutrition status of that breastfeeding mother. An intake of additional fat is recommended to meet the essential fatty acid needs. So this level of fat in the diet will provide adequate energy density, so high energy needs for the nursing mother. So it's very important to determine amount of fat depending on that nutrition status of that breastfeeding and activity done, to know exactly how much amount of fat needed and how much amount of energy can be obtained from fats, and also make sure all essential fatty acids which are obtained. So the source should be very clearly find those, provide good source. Good source where you can obtain all essential fatty acids. Now let's look at the mineral requirement during breastfeeding. Calcium is very essential, needed for milk production. Lactating mother needs about 1000 milligrams per day of calcium to be able to produce enough milk. Breast milk contains about 30 milligrams of calcium per each 100 mils. Based on that optimal output of milk of 850 mils of milk, so it will be needed 300 milligrams of calcium. It is required, calcium is required for fetal skeletal development, as we know that calcium. Iron. Normally there is no additional requirement of iron during lactation, as we know that breast milk contains a very small amount of iron, and the baby is born with enough reserve, since the breast milk is not a very good source of iron. The additional iron in the mother's diet during lactation does not pass on to the infant, but iron-rich foods are important for the mother's health, and the recommendations are the same as those of an adult. So there is no change on recommended intake of iron per day. It remains the same. Vitamins are also needed during breastfeeding period. just as calories, protein, and calcium requirement, they should be also increased in amount during lactation. Vitamins requirement, especially vitamin A, vitamin B1, vitamin B2, vitamin 3, vitamin C, and folic acid, and vitamin B12 are the major vitamins which are needed to be increased during lactation. Now let's look at the importance of breastfeeding. Yeah, can you tell me what is the importance of breastfeeding? What is
it? It ensures good growth of the baby.
Does it ensure good growth of baby?
Due to presence of essential nutrients required for the baby.
So, excellent. It contains all essential nutrients in right amount for the baby.
Yes.
Breast milk is a unique combination of the nutrients essential to child's health. It provides a number of health advantages beginning at birth and throughout the child's life. In fact, the large number of the health problems today children face might decrease or even prevented if the breastfeeding of infant was done exclusively for the first 6 months. Exclusive breastfeeding is unequivocal the preferred method of infant feeding in the first 6 months. Let's look at the benefits and advantages of breastfeeding. We've said that breastfeeding is the only natural food designed for the baby, especially for the first 6 months. So the infant should be fed exclusively with breast milk. Breastfeeding protects the baby from infection and diseases because it contains antibodies. So it increases and strengthens the immune system, so prevents infection and diseases. Breastfeeding provides health benefits for the mother. We're going to see what are those health benefits. Breastfeeding is free, available whenever and wherever the baby needs to feed. So it's free, available anytime, any place. The baby can just be fed, and also it's ready at any time in right temperatures. So there's no need to say that I'm going to warm it a little bit so that it can temperatures which the baby can use it well. It's always ready at right temperature. It can build a strong physical and emotional bond between mother and baby. Now let's look at the health benefits of breastfeeding for the baby, and then we're going to look at them for the mother's side. We've said that infant breastfeed longer, gets fewer dental cavities, fewer diarrhea, vomiting cases, less respiratory tract infection, and urinary tract infection. So in general, breastfeeding has got antibodies sent to prevent, as we've said, the baby infant from infection and diseases. So it reduces the dental problems, so child will have fewer dental cavities. It will reduce diarrhea problem and vomiting. Due to high immunity, the infant will get less respiratory and tract infection and urinary infection because the antibodies increases that or strengthening the infant immunity. Breastfed infants are less likely to become obese later in childhood, as we know that if you exclusive breastfeed your child in 6 months, there will be no supplementation of the other. Surely the infant can be overfed and can be overweight or obesity in the early stages, which can proceed into later stages. Breastfeeding may also decrease the risk of childhood cancer in children under 15 years age compared to formula-fed children. As we know that the one of the things which cause cancer are those things like this overweight and obese, yeah, they can lead in, yeah, they can also cause these different types of cancers. So if the child is not be able to reach those nutrition factors, will be safe, yeah, yeah, from cancer, especially under 15 years of age. Health benefits of breastfeeding for the baby, yeah, we've already talked about that. Yeah, breastfeed infant grow to adult with less chances to develop high blood pressure and heart diseases, overall non-communicable diseases. Breastfed children develop fewer psychological, behavioral, and learning problems as they grow older. Breastfed children were on average more mature, assertive, and secure with themselves as they develop. Benefits of the breastfeeding to the mother: it helps a woman to lose weight after birth. Yes, we know that all the weight gained during pregnancy because of the extra need of nutrients, all the reserved nutrients in the mother's body. If she did exclusive breastfeeding, was just being gone away, so lose weight to produce for milk production. So mother burn many calories during lactation when the body produces milk. Yeah. Breastfeeding release hormone in the mother oxytocin, which is called oxytocin, that causes the uterus to shrink and replenish the size. So uterus to shrink after giving birth. You know that uterus increases in size, loose. So through breastfeeding, it's release hormone, yeah, which helps the shrinkage of uterus, so it can return to normal size quickly. Breastfeeding helps a woman not becoming pregnant again. So sometimes it's after that. So if breastfeeding mother doesn't get a menstrual period, or not return to menstrual cycle, that's here, you got bed from. But immediately after breastfeeding mother gets menstrual cycle, so it should not be the birth control. So at that point she can get pregnant again. Yeah, breastfeeding appears to reduce mother's risk of developing osteoporosis later in years. Yeah, breastfeeding, because here also mother needs to eat a lot of diet, which contains a lot of types of which is calcium. Yeah, so we have a lot of deposition in calcium to use in the production, still to preserve our body. Yeah, so cannot get osteoporosis later in life. Breastfeeding causes the amount of insulin that the mother requires during postpartum goes down, so it helps diabetic women to improve their health. Yeah. So if the mother accidentally had diabetic during the time of pregnancy, what type of diabetic is it called? The diabetes which develop during pregnancy. Yeah, so if the mother had gestational diabetes, normally it tends to, during postpartum, it tends to go down. So to regulate, and the insulin becomes enough for the whole processes of conversion of this glucose in the blood. So it helps to improve the weight. So if the mother had gestational diabetes, it just go away and it becomes so to improve the health. Women who lactate for the 2 or more years reduce chances of developing cancer by 24%. And women who breastfeeding the infant has been shown to develop less uterine, endometrial, and ovarian cancers. Also emotional health of the mother may be enhanced, relationship will develop through breastfeeding, resulting fewer feelings of anxiety, strong sense of connection of the baby through breastfeeding. Also a woman's ability to produce all nutrients that her baby needs can provide. It provides confidence for the mother, because when you're breastfeeding your baby, you become confident that you are able to give the good food, that is breast milk, for your baby, which contains all the nutrients required by your child in the right amount. The relationship also, the bond, interaction, it's increased, and also it's helped, psychological, to build psychological foundation between the mother and the child, through many years to come. So the bond is increased. Now, diet recommendation during lactation. We said that the diet should include plenty of fresh fruits and vegetables, milk products, pulses, nuts, whole grains, eggs, to provide all essential vitamins and nutrients needed by the lactating mother during lactation. Also, the diet should contain enough fluids, which enough amount of fluids which are needed for the milk production. We know that milk contains a large amount of water, so the lactating mother need to take in a lot of fluids which will help in the production of milk. And the consumption of fluid can be in form of juices, water, buttermilk, milk-based beverages, plain water, etc. Any form of fluid type of things will just add up, will be adequate. The number of meals should be increased to meet the nutrition need. Food should be eaten in between meals, that's snacks. That's the feeding pattern should include 5 to 7. So you can have 3 big meals, and at least 2 or 3 snacks in between. Highly spicy and strong flavored food should be avoided because they tend to impact the flavor to the milk, which may make the baby not want to breastfeed. The baby will refuse to breastfeed when the flavor of the milk is not very good because of things like spice or strong flavors. So things which are very highly flavors or spice types of food should not be taken by the mother. Additional amount of fat needed, as we've already talked about that, to provide enough energy, and also amount of vitamins which are needed, such as vitamin A, in order to make sure they are enough for the production. Mothers can take special energy, protein, calcium, and dense foods, sometimes called ladles. These are certain types of seeds. These foods are galactogogers. They are linked to increase milk production. Galactogogers. All emotional problems, anxiety should be avoided during the lactation period. The mother should keep herself happy and stress-free so that enough amount of milk can be produced in her body. All drugs reached the baby through breast milk should be avoided. Before taking any medicine, the lactating mothers need to consult which type of medicine are allowed for the breastfeeding mother and which type of medicine are. Weight gain is important to be monitored around this time when the baby switch over to other foods, and mother needs to gradually reduce her calorie intake, otherwise chances of excessive weight gain will come. As we said that during pregnancy the weight of the mother tends to increase. After delivery, during exclusive breastfeeding, also the mother tends to eat a lot, and some of the mothers tend to gain weight, but some of the mothers tend to lose weight because they are using the milk production. But after exclusive breastfeeding, after the first 6 months, lactating mothers should be very careful to watch her body weight so that she cannot gain more weight and be overweight or obese. So that if differs in depending on one mother, one mother that is not the same with another mother, because it's depending on so many things. The amount of baby breastfeeding, frequency, depending on type of activity the lactating mother is engaging. So that's so. What is colostrum? What is colostrum? What is it? What did they say?
It's the first milk that a mother cried after giving birth to a child.
Yeah. What does it look like?
That is
It's
contains protein, carbohydrate, and less of fat.
I'm asking, what does it look like?
yellowish color.
Rich in color.
Yeah, yellowish in color. Yeah, colostrum will say provide all the nutrients. Yeah, because it will say rich in antibody, so it acts as immune function of the infant. We say colostrum is high in protein, high in sugar, calories, but low in fat. So it's very type of food that just in that because the digestive system is very important. So it's a very big type of food for the infant in the first days. And that's the important elements breastfeed. At least immediately or 1 hour after the mother has milk. Yeah, is a thin yellow milk fluid that is the breast milk available after birth. It is high in protein, high in calories, high in sugar, but low in fat. Yeah, it's provided approximately about 20 kilocalories per ounce, rich source of antibodies which protect the infant against infections and diseases. Let's look at the unique property of colostrum which make it beneficial to the baby. Colostrum is low in lactose, it's not high in sugar. Yeah, it's low in milk sugar, which is lactose. Just high in protein and high in carbohydrates. Low in lactose, this is sugar found in milk, and low in fat. So colostrum is lower in lactose than mature milk and is easily digested by a newly born baby. Yeah, with not well developed digestive system. It facilitates the passage of meconium, feces, stool, neonate, that colostrum. That's very important to make sure your child gets this colostrum. It is high in antioxidant and low in water soluble vitamin than mature milk. It is high in fat soluble vitamin, protein, sodium, potassium, fluoride, zinc, and immunoglobulins than mature milk. Okay, now here I've got some study questions which I want you to copy now. How many minutes will you need to copy? Hello?
20 minutes.
Yeah, so please use 10 minutes. Copy. You are going to try to answer only. So use this 10 minutes to copy the question. Then you try to discuss only 2 of them. Okay, continue, proceed with the copying. Proceed with copying 10 minutes.
Okay, thank you.
Hello, have you finished copying? The time is
Yes,
running so
ma'am.
fast. Yeah, okay. If you finish copying now, let's start. Yeah, we are going to discuss question number. Yeah, question. Yeah, we're going to start question number 3 first. Yeah, the question says that analyze the influence of maternal nutrition status before and during lactation on breast milk production, on breast milk composition. Analyze the influence of maternal nutrition status before and during lactation on breast milk composition. So that is the question. The question asks analyze on that situation. I want to first explain what does the analysis or analyze mean. If we get a question which asks you to analyze on something, what does it mean? Analyze means to examine carefully by breaking it into parts and explaining each part in detail, showing how they are related. Or analysis is to study something in detail by breaking it into parts and explaining the relationship among those parts. So that's why I've been speaking, I mean the same. So you need to examine or studying something in detail by breaking into several parts and then try to explain what is the relationship between those parts. That is the meaning of analysis, or if you ask to analyze something. So key features of analysis or analyze, there you need to break the topic into components. You need to examine the causes, the effects and relationship. You need to show how and why things happen, the way they happen. You need to use examples or evidence. You need to make connection between the ideas which you are asking. So the analyze questions, they are a little bit tricky, so you need to make sure that you exhaust everything. You need to make sure you exhaust everything. Unless otherwise you just end up mentioning 2 to 3 sentences and then you say it's it. No. You will not be able to get 25 marks by doing so. So let's look how we're going to analyze this type of question. So the question asks you to analyze the influence of maternal nutrition on breast milk production. That is the question. It asks you to analyze the influence of maternal nutrition . Yeah. So, the question asks you to analyze the influence of maternal nutrition on breast milk production. So that is the question. Maternal nutrition is the same with maternal nutrition status. Is one thing. Nutrition status is what determines the nutrition state of somebody. So maternal nutrition status is the same with maternal nutrition. So don't be confused. So the question asks you to analyze the influence of maternal nutrition on breast milk production. So how are we going to go about? First of all, the question, there are two situations which I didn't mention there in the question. There is a situation before lactation and during lactation. Those are situations which we are going to talk it later about while discussing. You should bear in mind also, we've got later we are going to ask this question even looking at these two situations. But at first, we need just to have analyzed the influence of the nutrition on breast milk production. So what are we required to do? We need to we are required to identify different aspects of maternal nutrition. During analysis, we require to identify different aspects of maternal nutrition, that is energy, protein, carbohydrates, fat, micronutrients. Those are maternal nutrition, nutrients which are needed. Defined aspect regarding to these nutrients. Then we require to explain how each affects breast milk. Yeah, how each these nutrients affect breast milk. How energy affects, how protein affects, how micronutrients affect. Also, it required to show the effects on both the mother and the infant. So we need to look at the two sides of the coin. Yeah, because it has got influence on the part of the mother and also the part of the infant. Yeah, so we've got two situations, and here we've got two sides. We also require during analysis, it required to link poor or good nutrition to change the milk production or milk composition. So this is the analysis. So if that gets good nutrition, what will happen? If she gets bad nutrition, what will happen? Effect of poor nutrition or good nutrition. What will happen to the changes of milk composition? That is what milk production, composition of milk produced. Or you can say, milk composition of the milk produced, breast milk was produced. So this is how we are going to think about. So this is analysis, and this, what I said, they are what we require to do. So now let's go to our question. Then, okay, you're going to say about maternal nutrition status before and during lactation plays an important role in determining both quantity and quality of the breast milk. That is the first sentence you need to acknowledge. That maternal nutrition status, either before or during lactation, plays an important role in determining quality and quantity of the breast milk produced. So although the body has a protective mechanism to maintain milk, as we said previously, that regardless of nutrition status of the mother, there is a mechanism in the body of the mother which maintains the composition or production of milk to have adequate all amount of nutrients. So we say that even the mother is, when the mother is severely undernourished, not severely, moderate of course undernourished, there will be no much effect. But if mother is nourished, that means all the nutrients which has been preserved, stored in her body will be depleted, will be used to produce breast milk in order to make it to a adequate composition of good quality. But eventually, if those reserves are used, this severely malnourished mother, now that's when it will affect. But in the time being, it will affect until all the stores the mother body is depleted. That's when we talk about that. So those are just the first explanation to look about, which are linked to that analysis question. Then now let's look at maternal nutrition before lactation. How will this affect the composition of milk? Maternal nutrition before lactation. I said the two situations. So let's look at maternal nutrition before lactation first. So maternal nutrition before lactation will influence mother's nutrient store basically, as we say that the composition of the milk in terms of quality rather does not depend on what the mother is eating on daily. So maternal nutrition influences mother nutrient store. So it uses just the nutrients which has been deposited if the lactating mother does not get all that nutrient required in her daily diet, which later, if the situation proceeds for a long time and all the nutrients which has been preserved have been used, that's when the problem will come. But if not depleted, we'll use the small amount of store to produce and make sure that the composition of breast milk is good. Yeah, breast milk is a good quality. So so during, when we are talking about maternal nutrition before lactation, we're talking about pre-pregnancy, before getting pregnant, and during pregnancy. When you look at maternal nutrition before lactation, normally we look at nutrition pre-pregnancy, that is before pregnancy, and during pregnancy. So if the mother during this time, yeah, the mother was not getting adequate nutrients, that mother will not have a very good nutrient store or nutrient reserve. So automatically it be depleted very soon and later will affect the composition. If during pre-pregnancy and pregnancy the mother will not taken adequate nutrition, that mother will have poor nutrition status due to inadequate intake of nutrition, and this will make low nutrients availability in her stores. So this will be used without affecting the quality, but rather the quantity. So the quantity, the volume will much be affected rather than the quality. So those are the two situations. During maternal nutrition before lactation, that is during pre-pregnancy and during pregnancy, if the mother was taking adequate nutrition, everything will be alright. If the mother was taking inadequate nutrition or poor nutrition status, everything will be low. But at the moment, the composition will not be affected, that is the quality, but the quantity, volume will be affected in long run. But if the situation went worse, everything might be affected. So that is the situation. Look at maternal nutrition before lactation. Then we're going to look at the energy and macronutrients. Yeah, in the energy, say we're going to look at this maternal nutrition. We're going to look at these nutrients: energy, protein, fat, micronutrients, and others. So in the side of energy and macronutrients, we are going to look first at those which provide energy. So energy and fatty content, those are the ones energy for the body mainly. So fatty content of the breast milk, I've said in the beginning, is influenced directly according to the maternal intake and body fatty stores. So if the body fatty stores has been depleted and the mother is taking the food which is inadequate in fatty content, automatically this will be reflected in the composition of the breast milk. That is the case of energy and fat, specific fat. After depletion of those fat which has been stored in the lactating mother. Then, after finishing using the body fatty stores, then if the mother diet is inadequate in fat, then fat deficiency in the composition of breast milk will show directly. Yeah. Yeah. For undernourished mothers, yeah, I've said that they will produce the milk with lower fat after using all the fat which is stored. Yeah. But undernourished mother will have reduced amount of energy which supply to the infant, and this also will affect the overall production of breast milk because energy is needed in the overall activity of production of the milk. In the side of protein, milk protein content is relatively well preserved even in undernourished mother. So whether mother is taking inadequate or adequate, the protein content in the breast milk will not be affected. But severe protein energy malnutrition can slightly reduce the milk quantity. In the side of carbohydrates, which is lactose, this is sugar and milk, Lactose concentration remains fairly constant and it's minimally affected by maternal diet. So carbohydrates, lactose concentration in the breast milk is remained fairly constant. It is minimally affected by maternal diet. So whether it's undernourished or well-nourished, lactose does not affect. This is about the composition. Lactose concentration in the breast milk. Yeah, when we look at now that was about energy providers. Yeah, that is fatty content. Yeah, and we look about protein, and we have to look at about carbohydrates, and now we have to look at micronutrients. Yeah, there are certain micronutrients which are sensitive when there is a deficiency. Yeah, there are certain vitamins and minerals in breast milk. Yeah, intake. Yeah, they're highly depending on the diet which is taken in and maternal status that we talk about reserved, which are reserved in the body. But this will be especially for fatty soluble vitamins, which are very reserved. Water soluble vitamins are not reserved. Excess is being carried out, so it must be taken in daily terms. So fatty soluble vitamins, which are strongly influenced by maternal diet and body stores, are fatty soluble vitamins, which are vitamin A, vitamin D, and vitamin E. So those are fatty soluble vitamins which are strongly influenced by my maternal diet and body stores. So these are very sensitive. If they are deficient, they can affect the composition of them in their breast milk. Water soluble vitamins. This especially thiamine, riboflavin, that is vitamin B1, vitamin B2, vitamin B6, vitamin B12, and vitamin C reflects the maternal intake, because we know water-soluble vitamin cannot be stored in the body. They should be taken in daily diet. So these are very sensitive types of water-soluble vitamin. If they are deficient, it will reflect the recent maternal intake, and it will affect the overall composition of the milk. Minerals, there are some sensitive minerals such as iodine and selenium. And their level in breast milk depending greatly on maternal intake. So poor maternal intake will make deficiency. Breast milk will have deficiency of iodine and selenium. So if there is poor maternal nutrition, can lead into lower micronutrient concentration, and it can increase the risk of deficient infant, because there will be deficiency in breast milk. Another things to consider on analysis is look at the nutrients which are less affected by maternal diet. I was talking about nutrients which are sensitive to breast milk production, micronutrients. Now I'm looking the one which are less sensitive. As I've said in the beginning, that minerals like calcium, iron, zinc. Normally there is a maternal physiological regulation in it. So if there's deficiency in the diet or in the body, there will be a less effect. Things like lactose, we talk about lactose, and most immune factors, if they are deficient, there is not much effect. However, maintaining this level may come with the expense of maternal body store intake inadequate. As I've said that if it's not taken into the recommended or needed amount, then body stores will be used to compensate if it's reached that time. Now let's look at the effect of undernutrition during lactation. We've been talking before lactation. Now let's look at the effect of undernutrition during lactation. During lactation, if there is undernutrition, milk volume may decrease. Maternal energy severely undernourished, inadequate. So the only volume will decrease. The quantity will not be altered. Maternal deficiency may worsen. Situation like mother will be fatigued, weakened immunity, and poor health. Infant growth also indirectly may be affected. In terms if the milk quality will be interfered, if there is specific nutrient deficient or insufficient in a long period of time. I've talked about protective physiological mechanism that which protect the quality of the breast milk. The body prioritize the breast milk production, protect the infant even under moderate maternal undernutrition. Milk production continues to be good, unless when all the nutrients in the mother's stomach is depletion, and this normally happens over time. The maternal nutrition status before or during lactation significantly influences the composition, especially fat content and some of the micronutrients, those which are said are sensitive to maternal intake. I talk about water-soluble vitamins, vitamin B1, 2, 6, 12, and vitamin C. I talk about fat-soluble vitamin A, D, and E. I talk about 2 minerals, iodine and selenium. So that's all about analysis. I think you got something about this question. Did you get something? Hello?
Yes, madam.
Did you get something?
Yes, madam.
If that is so, I just want to go just quickly about question number 6 as another example in the analysis, but a lot have been also I've already been discussed how to analyze. So I'll just pass here quickly. Analyze the consequence of poor diet during lactation on both mother and the baby. As we've been discussing what analysis means, you just need to analyze the consequences of poor diet. Is the same like the other one during lactation. This is specifically during lactation, and for both sides, for the mother and the baby. So you just look at what are the consequences which will happen for the mother, and then you look at what are the consequences which will happen for the baby. So what are the consequences which will happen for the mother? You talk about nutrient depletion, because inadequate intake of diet leads to the depletion of body stores, energy, protein, calcium, iodine, vitamin. I've talked about that. So the first consequence to the mother, it will be nutrient depletion from the stores, body stores. The second consequence for the mother will be increased risk of deficiency. After using all the body store, so it will increase the risk of deficiencies. And the mother may be anemic, because of deficiency of iron, folate, vitamin B12. The mother might have bone mineral loss because of calcium and vitamin D deficiency. The mother can get night blindness and poor immunity because of vitamin A deficiency. So those are the consequences of effect of the increased risk of deficiency. Another consequence for the mother, it can be reduced energy and well-being. We've already studied from previous analysis. Another question, inadequate caloric intake normally cause the mother general board energy deficiency. Inadequate calorie intake, body deficiency, fatigue, weakness, poor recovery, no energy, reduced ability of their care and taking care of child. Another consequence is compromised immune function of the mother. Poor nutrition, it will weak immune system of the mother, increasing susceptibility to infection disease for the mother. So those are the major 4 consequences. Nutrient depletion, increased risk of deficiency, reduced energy and well-being, and compromised immune function. So those are the 4 consequences of poor diet during lactation for the mother. Consequences for the baby, the first one is reduced milk quantity. Here we're talking about quantity. Quantity is volume, not quality. Reduced milk quantity, which is specific about volume. I talked about if the mother got deficiency of several nutrients, what should be affected is the milk quantity. So reduced milk quantity or volume, not quantity. And especially when there is severe maternal undernutrition. But if it's moderately, still the reserve can be. So consequence for the baby, there will be a reduced milk quantity or reduced milk quantity or volume. Another consequence for the baby will be lower micronutrient content in the breast milk. Yeah, I've already talked about that. Poor maternal diet can reduce the level of certain nutrients, and some of them are very sensitive, but others are less sensitive. So we are looking at those which are very sensitive. I say water-soluble vitamins. Yeah, say water-soluble vitamin, B1, B2, B12, B6, overall B complexes, we can say. B complexes, all B6, B12, and fat-soluble vitamin, I say vitamin B, vitamin A, vitamin D, and vitamin E. I say 2 types of minerals, which are iodine and selenium. Or this increases risk of deficiency in if they are lower in breast milk. That is the second consequence for the child. The third is impaired growth and development. Yeah, impaired in growth and development of the infant. As we know, if the protein is deficient, what will happen? Yeah, it results into poor weight gain for the child, or poor weight gain and slow in development. Yeah, and growth in general, increasing height, length. Yeah, or link between age and height. Yeah, and then the fourth one, consequence for the baby is the increased susceptibility to illness due to the reduced immunity. Yeah, so they are similar, like the mother. Consequence for the baby, the first one is reduced milk quantity or volume. The second one is lower micronutrient content in the breast milk. The third one is impaired growth and development. The fourth one is increased susceptibility to the illness. That means immunity has been reduced, so more susceptibility. So that's what. I think now we have understood well how to answer this analysis question.